Amenorrhea is a term used in medicine to describe the absence of menstrual periods in someone who previously had regular cycles or who has reached the age when menstruation is expected. While it might seem convenient at first to not have periods, amenorrhea is often a sign that something in the body has shifted or changed. Understanding the possible causes, implications, and treatment options for amenorrhea is essential for anyone affected by this condition. Let's begin by exploring what amenorrhea actually means. There are two main types, primary and secondary. Primary amenorrhea refers to the absence of menstruation by the age of 15 in someone who otherwise shows normal growth and sexual development. Secondary amenorrhea, on the other hand, occurs when someone who previously had regular periods stops menstruating for 3 months or longer, or for 6 months if their cycles were always irregular. Amenorrhea isn't a disease in itself, but rather a symptom that something else might be happening in the body. The menstrual cycle is a complex process, regulated by hormones produced in the brain, ovaries, and other parts of the body. At its core are signals from the hypothalamus and pituitary gland in the brain, which communicate with the ovaries to trigger the release of eggs and produce the hormones estrogen and progesterone. When this system is disrupted, menstruation can stop. So why might someone stop getting their periods? The possible causes are diverse, ranging from natural life stages to underlying health conditions. One of the most common reasons is pregnancy. If fertilization and implantation occur, the body produces hormones that maintain the uterine lining, preventing menstruation. For sexually active individuals, a missed period can be one of the earliest signs of pregnancy. Another natural cause is breastfeeding. After childbirth, many people experience a pause in their periods, especially if they are breastfeeding. This is due to high levels of the hormone prolactin, which suppresses ovulation. Menopause is another life stage when periods naturally stop. Menopause usually occurs between the ages of 45 and 55, marking the end of reproductive years. The ovaries gradually stop producing eggs, and the levels of estrogen and progesterone decline, leading to the cessation of periods. However, amenorrhea can also signal health issues or lifestyle factors that disrupt the hormonal balance necessary for menstruation. Excessive exercise is one such factor. Athletes, dancers, or anyone engaging in intense physical activity may experience amenorrhea, especially when combined with low body fat. The body interprets excessive exercise and low energy availability as signals that it's not an ideal time to reproduce, so it temporarily shuts down reproductive functions. Significant weight loss or eating disorders like anorexia nervosa can also cause periods to stop. The body requires a certain amount of fat and nutrients to support the menstrual cycle. When deprived, the body conserves energy by halting non-essential functions, including reproduction. Stress can have a surprisingly strong effect on the menstrual cycle. Physical or emotional stress can disrupt the delicate hormonal signals from the brain, leading to missed periods. While the body is designed to weather short-term stress, prolonged or severe stress can result in amenorrhea. Certain medical conditions can also lead to amenorrhea. Polycystic ovary syndrome, or PCOS, is one of the most common causes. PCOS is characterized by hormonal imbalances that can result in irregular or absent periods, acne, excess hair growth, and sometimes cysts on the ovaries. Thyroid disorders, such as hypothyroidism or hyperthyroidism, can also disturb menstrual cycles, since the thyroid gland plays a key role in regulating hormones throughout the body. Problems with the pituitary gland, a small gland at the base of the brain, can lead to amenorrhea as well. Tumors or other conditions affecting the pituitary can impact hormone production, disrupting the menstrual cycle. Structural issues may also be to blame. Scarring of the uterus, known as Asherman syndrome, can occur after certain surgeries or infections and prevent the uterine lining from building up and shedding as it should. Congenital abnormalities of the reproductive tract may also prevent periods from starting in the first place. Medications can sometimes cause amenorrhea as a side effect. Certain types of hormonal birth control, such as the shot or hormonal IUD, can stop periods for some users. medications used to treat mental health conditions, chemotherapy drugs, and some blood pressure medications can also interfere with menstruation. Given the range of possibilities, how do doctors figure out what's causing amenorrhea? A healthcare provider will typically start by taking a detailed medical history and performing a physical exam. They'll ask about menstrual history, lifestyle factors, exercise, diet, and any symptoms such as weight changes, hair growth, or hot flashes. Pregnancy tests are usually done first to rule out pregnancy. Blood tests may be ordered to check hormone levels, and imaging studies like ultrasounds may be used to look for structural causes. The treatment for amenorrhea depends on the underlying cause. If lifestyle factors such as stress, excessive exercise, or significant weight loss are to blame, addressing these issues often restores menstruation. This may involve working with nutritionists, mental health professionals, or adjusting exercise routines. If a medical condition like PCOS or a thyroid disorder is identified, treating the condition usually helps periods return. For example, thyroid hormones can be replaced in cases of hypothyroidism, and medications can help manage PCOS symptoms. For those with amenorrhea caused by hormonal contraception, periods may return once the medication is stopped, although it can take a few months for cycles to normalize. In cases of structural issues like Asherman's syndrome, surgical intervention may be necessary. It's important to recognize that prolonged amenorrhea can have consequences beyond fertility. Estrogen plays a key role in maintaining bone health. Without regular periods, the body may not produce enough estrogen, leading to weakened bones and a higher risk of osteoporosis. While it's not uncommon to miss a period occasionally, due to stress, travel, or minor illness, missing periods for several months in a row is worth discussing with a healthcare provider. Early diagnosis and treatment can prevent complications and help maintain overall health. In summary, amenorrhea is a symptom that can have many different causes, from natural life changes like pregnancy and menopause to medical conditions, lifestyle factors, or medication effects. Understanding the underlying cause is the first step toward restoring menstrual health and overall well-being. If you or someone you know has stopped getting periods, don't ignore the change. Reach out to a healthcare professional who can help uncover the reason and recommend the best course of action.